I can hear it. Okay, so we're probably live like any second, maybe even now. I don't know, but I'll tell you when I definitely know.
No worries. Live now, it's just told me.
Okay, fantastic. So a massive hello to everyone here inside the Superhuman Summit. I'm just going to click back in there. There we are. Hi to everyone here in the Superhuman Summit. You might be joining us via Zoom, in which case, hello through Zoom. You might be joining us via the Superhuman Summit itself inside the group, in which case, hi to you through there. I'm just going to quickly find myself inside the Superhuman Summit group. And then what I'd love to be able to do is to introduce our speaker for today, Craig Denny. And thank you so much, Craig, for arranging your schedule and committing the time to be able to share some of your insights with us. We've had such amazing generosity from all of the speakers so far, and that's really what's enabled the summit to, you know, be sharing all the different insight and knowledge that it has to a wide range of people. So hugely appreciate your willingness to do that. And so Craig will talk a little bit more about what he does, but he's a hypnotherapist. So you might want to talk a little bit about what that is to start with for people who don't know Craig or have never been to a hypnotherapist. And then specifically today, the title of Craig's talk is Why Chronic Pain is Emotionally Based. Now, I don't know about everyone else, but I have a very strong personal interest in this topic for a lot of different reasons. So I'm really interested to hear what you've got to share with us and what we can learn today. So I shall hand it over to you and you can take it away. As always, if you're watching and listening, please drop in any questions that you've got and we can make sure that Craig answers those as we go along. Thanks, Craig.
Okay, well, thank you. Yeah, it's been great. I've been watching some of the other speakers and it's been great to have all that information coming through. I've been a hypnotherapist for around 6 years. I've had my business here in Charlestown now. Prior to that, I was a paramedic for a lot of years. And so I got to see, you know, a lot of stress and a lot of pain in that job. And that's what was the driver to me becoming a hypnotherapist. So hypnotherapy, I mean, I know that Lucy Ellis spoke recently about hypnotherapy on here as well. And it's sometimes there's some misconceptions around that. But hypnotherapy is quite a simple process. It's just getting into that relaxed state where your subconscious mind is more suggestible and we can get you to just relax and make some changes. A lot of people forget that they're in hypnosis a lot of the time when they're watching a TV show, for example, and you sort of vague out and can't remember the last few minutes of the show. You've lost track of the show. And of course, that's why advertisers love to advertise when they do, because you're more suggestible when you're in that state. So that's why advertising is a lot more effective. Another time is, you know, people on long drives and they vague out on a freeway, and they used to call that highway hypnosis, where you can't remember the last 10 minutes, you've just been cruising along, you're in hypnosis then as well.
Ah, so those times when you're vaguing or zoning out and you don't have a memory of that time is because you're under hypnosis, is that right?
That's right, and there's different
states. Does that mean different things around you can accidentally induce accidentally or intentionally induce a hypnotic state and you're not aware of it?
That's right, because you're sort of, it's like a wave and you're in and out throughout the day, you know, there's just those moments. Whereas when you come in for hypnosis, it's slightly different because we are getting you into that nice deep state, getting into that place where you can really relax and we can start making some changes with you. So we've got a direct intention when we work with you for a specific outcome, of course, because you've come for that outcome. So it's more guided and it's more directed.
Do you mind if I ask you, how did you decide to change from being a paramedic to becoming a hypnotherapist? That's quite a change.
Yeah. Well, it's just I'd had a lot of time there. I'd sort of been through everything that I wanted to go through with the ambulance service. It's not what it used to be. It can be quite a violent sort of job. So I wanted to change from that. I wanted to just and work on my own business, because I had never had my own business before. I'd always been employed. And as I said, I just wanted to help people. I had a lot of colleagues that I worked with who'd suffered from PTSD and anxiety and stress. And so I did a lot of research, and I found that hypnosis is one of the most effective tools for a lot of that stuff. And also the chronic pain, that sort of came in a bit later after I'd been doing hypnosis for a while. My wife was diagnosed with something called spondyloarthritis, and she was in a lot of pain. And I knew that hypnosis was quite effective for pain, but I wanted to get a little bit more. So I did some other study where I specifically learnt more about the pain treatments so that I could help her.
Fantastic.
So, yeah.
If you don't mind, just like, I guess starting at its most basic. So what I mean by that is that if you were to go and, interview 10 people off the street and suggest to them that their back pain they'd had for ages, or their ankle pain or their neck pain or whatever that they'd had over a period of years was because of an emotional cause rather than a physical cause, a lot of them would not understand that. They would, So can you just start from the real basics for us about how it works? That'd be awesome. And a lot
of them. And when we say pain too, for me, I say it's anxiety or it's physical pain. For me, they are the same, pretty much the same thing, the same treatment. I get the same results. So I studied a lot of the work by a doctor called Dr. John Sarno, and a lot of people have heard of him when they've had long-term chronic pain. He wrote a book in the 80s called Healing Back Pain, and found that when people read that book, oftentimes the chronic pain that they had would dissipate because after they finished reading that book. So he discovered something called TMS, which is tension myositis syndrome, it's called, or sometimes he called it MBS, mind-body syndrome. And what he believed was people would have a significant emotional event in their life. And because being a hypnotherapist, I work a lot with the conscious mind and the subconscious mind, and I talk about that a lot, and how the subconscious mind is that deeper part of your mind that's there to protect you, to care for you, and to look after you. When people experience a significant traumatic event, and it doesn't always have to even be significant, but maybe back in the past when they experienced it, it was for them. Sometimes I talk about a lot of people had something go on when they were maybe 8 years old, and now they look back on it and they say, oh, it wasn't that big a deal. But for that 8-year-old, it was quite a big deal. They forget how much we look at things differently once we've gone through all that time and learnt so many lessons. So Dr. Sarno used to talk about tension myositis syndrome, as I said, and he said that generally the people who have got the chronic pain and can be categorised as possibly having TMS are people that worry a lot. They're people that are often perfectionists, and they put a lot of pressure on themselves. So it's people that really pressure themselves to do things, to be perfect all the time. They're often people that are under a lot of daily stress, and they often have a lot of feeling of overwhelm. They often have a lot of negative thoughts, and they can often be very self-critical.
So if I can just ask a question then on that, it sounds to me like your personality and your thinking is going to be very connected to whether or not you're those kinds of, you have those personality traits that you're just describing. Is that right?
That's right, yeah. And they're often people that go out of their way all the time to help others. And I worked with a nurse recently with chronic pain, and she was the same. They've spent a large portion of their life so hard working, striving to help others, and they've forgotten about themselves, and they just don't care for themselves. They don't give themselves enough time, enough love, enough caring for themselves. And so what we do is, and when we relate it to the stress, I say to people, that a lot of people say, oh, I've had a really bad day at work, I feel a stress headache coming on. And straight away there, they make that connection that the pain in their head is connected to their emotions, to their feelings, to their stress. But, they don't say, oh, I've had a really bad day, I know that back pain's really going to kick in today. They forget that that's generally what's happening. They just haven't really thought about it. They haven't really thought about how often that happens. And I work with a lot of people with fibromyalgia as well, and that can often be the case. It's just that. So as I was saying before, that subconscious mind wants to protect you so much that there's been some sort of trauma in your life. And what Dr. Sarno found was that the subconscious mind would cause some oxygen deprivation to a part of the body, like the lower back, a lot of people with sciatica, and that would cause pain. Then the person's no longer thinking about that traumatic event in their life. They're so focused on that back pain, and the subconscious mind goes, yes, I've done it. I've stopped them thinking about that horrible time in their life, that trauma that they've been through. And it can hold on to it for years and suddenly bring it back for them without them realizing they forget. So I've got a way that I can talk to the subconscious and say, when did you decide to use this pain to protect this person? Do you remember how old they were? And it will generally say yes, and we'll work out the age from there, and we'll say what happened when at that age.
So basically then it sounds to me like you're saying that our pain is our body's way of helping us avoid the traumatic emotion.
That's right, like a smoke screen or a diversion. And so as long as you're diverted and thinking about that pain, a lot of the time the emotion component of it has dissipated, or maybe gone completely, or just, less focus on it anyway. And so that's generally, and that's how I say it's often similar to anxiety. It's the same sort of thing. Instead of the physical pain, you're running in that fight or flight response, have all that anxiety going through your body. Again, the subconscious mind's just turned that on. It thought it needed to protect you for some reason, so it's put you into that state, and started those reactions with the increased heart rate and all the rest of it. Because as you, I
was just going to ask, so have you noticed any connections between particular emotions that you're trying to avoid and where you feel the pain in your body? Like, is anger usually in your lower back, or is grief normally in wherever in your arm? I don't know, but have you noticed, is there correlations between those?
I don't really look at it in that respect. I know that I did years ago when I read some other books on stuff, and I understand, back in the day, Louise Hay used to talk about that a lot, and so I do. But for me, it doesn't matter where it is. It's still a trapped emotion that someone's just pushed back inside, and it needs to be released. So I just find out what the specific event or the emotion is, and we work on that. It's often anger. When I do hypnosis with people, one of the first sessions is an anger release, because a lot of people are holding on to anger and they don't realize it. And I say to people all the time, it doesn't mean you're an angry person, but at some point in time, you've had numerous episodes of anger, and that can just build. And then some people will suddenly think, they react to something and they think, whoa, I overreacted a little bit there today. And that's often because the subconscious mind is just holding on to all these other angry events in their life and saying, oh my God, this has happened to me again, or, so they can react to it more than they should because they feel like it just keeps happening. And often they're not really consciously aware of that. So anger release is a good thing. And it's similar. I've worked with some young mums who may have had back pain, hip pain, whatever, after the birth of the baby. And a lot of the time I've found with, some of them, they're so stressed and so worried that they're not going to be a good mum, and there's so much pressure. They can often have pressure, from parents or relatives or whoever telling them to do this and to do that. And again, so that's similar to that perfectionism. They just so desperately want to be a good mum, and they put so much pressure on themselves that it can manifest as pain. And maybe they caused a little bit of damage during the birth, but that pain shouldn't be going on for years later. It's often because of that emotional event that happened back around that earlier time.
So can I ask you a question about I think what you were referring to earlier is that for some people you can have an experience that creates a trauma and ultimately leads to pain further down the track. For other people, they could have exactly the same experience, but it wouldn't be a trauma to them. So can you just speak for a second to the subjectiveness of pain and trauma?
Yeah, and it's hard to predict beforehand, before you work with somebody, because you don't know. It's because they don't have to be one of those traits that we talked about earlier. It can still happen with other people, or they may not even be consciously aware of some of those traits that they've got. And some of the stuff and some of the trauma can be so far back as well. You know, I worked with a lady who was 60, and she said her back pain started when she went on a bus trip from Newcastle up to Grafton, and she sat on a bus all day. She got off the bus that day and had back pain ever since. And she put it down to that. And any time she went into a car or a bus, she expected to get back pain, and sure enough, she did, because she'd programmed that into her mind that that would cause that pain. We did the work, and after we worked with her, we ended up going back to when she was a baby and mum and dad were fighting. There was lots of violence in the house. Once we worked on that event and let some of that stuff go, her back pain went like that, and she hasn't ever had it since. So it's a matter of just doing a little bit of digging and finding out what could be happening. So I'm not so much on the traits, but they are often common traits that can be happening. I think I diverted a little bit, did I?
It's all good. Yeah, it's all good. Yeah.
And so I worked with another lady who had knee pain, both knees, some arthritis. She went to the doctors and all the rest of it. And of course, I don't work with anyone with any chronic pain unless they've been to their GP and gone through all of the tests and everything else to eliminate every possible medical reason, so they know exactly what's going on. She had arthritis in her knees, bad knees. The doctor told her that it's a perfect storm. It's going to get worse as time goes by. You live on the second floor unit. You're going to have to sell your unit and move, which of course made her more stressed and upset, made the pain get worse. So she came to work with me, and we talked about, and she remembered the day that the pain started in her knees. And it was when her husband was ill with cancer, and he was in the Mater Hospice here in Newcastle. It was his last few days alive, and she remembered feeling the pain during that period, and she'd had a lot of guilt around her husband passing and not doing this for him and that for him. And we worked on that stuff, and then sure enough, the knee pain went, and now she rides a bike and she's got no intention of moving it from her unit.
And do you think, in your experience, do you find that some people are more able to process their emotions in a healthy way and therefore get less pain, and other people are less able to process their emotions, therefore have more pain?
Yeah, that's right. And some people just have that habit, like I said earlier, of really pushing those emotions down and trying to squash them and just forget about them. And a lot of people have been brought up that way, just toughen up and just ignore it and get on with it and all that sort of stuff. Whereas people that have had a healthier upbringing, that are able to talk about stuff more, oftentimes don't experience the same level of pain, and they can get rid of it easier.
And it's interesting, I know you're talking about pain in relation to an individual's experience, but I often think about it in relation to organizations, because when we go in and work with organizations, effectively what we're doing is trying to go through a healing process for a whole lot of people that have a whole series of pain from things that have happened in their life that have often been made worse because they're a member of a certain organization and they've been treated in a certain way. Mm-hmm. And I think the interesting thing about that is organizations in general would normally not take any kind of responsibility for the fact that someone's in pain. Does that make sense?
Yeah. I worked with a lady who worked in a very large, she worked for Hunter New England Health, which is massive, obviously. And she was just working in a particular office. There's a lot of stress and tension in that office. And she was getting migraines more and more frequently. And with her, I had to work on just being able to let things go, increase her own self-esteem and her own self-belief, and being able to just let all the stuff go that was around the office, just not take it on anymore. Know that there was people whispering and doing this and that all around her. She was just going to work, trying to do the right thing, but she was just taking on too much stuff. And that was basically the event that was causing those migraines for her. So once she was able to walk into work and, I use that old expression, like water off a duck's back, she'd just walk in there and go, whatever, you guys can, have your little private meetings and stuff. I don't care, I'm just doing my job. And she just said it was so different. And then eventually, as you've talked about, I think, the neurology making changes in your world, in your life. And sure enough, one of those ladies decided to move to another workplace, and everything started to settle down because she just lifted herself, I believe, to that higher level, feeling better about herself, and the others that were around her that were more negative, and they just weren't able to be around that. It sort of just drives them out without even saying anything. I sometimes talk about the Heart Math Institute and heart-brain coherence, and how if you can get your coherent level up to a higher level, then you pull people.
Would you like to describe that for everyone? Because not everyone's aware of heart math, but it's such a powerful process. It would be great to hear more about.
Yeah, well, it's the Heart Math Institute has an office down at Macquarie University, and they've done a lot of research. I've got a little heart math sensor in my office here that you clip on your ear, and it measures the heart-brain coherence. So we know that your heart emits a frequency which is measurable, and we know that people that are in negative emotions, feeling sad or angry, are running at a lower frequency than feeling grateful or love, or those positive emotions. We know now that you can actually measure it and see that there is a difference, which is why, of course, you can walk into a room and think, wow, they're not in a good mood today, because your heart is picking up that frequency of that person. And I often say that a lot of people don't listen to the other, they talk about the three brains, the brain, the head, the heart, and the gut, the intuition. And I think a lot of people don't listen to the other ones as much anymore. Everyone's so much in their head, and they forget about, back in the day when we were living in tribes, they'd know straight away if there was something dangerous in the bushes, because they'd feel it. They'd just sense it with their heart or with their gut. But now they'd be thinking, oh, it's probably not, and maybe not, maybe it's this, maybe it's that. They don't react to the instincts as much as we could. And so the Heart Math Institute has done a lot of research, and they've found that if you can just focus on your heart and have a feeling of gratitude for 2 minutes, they've found that increases your immune system through the roof for up to 8 hours. And so
So say that again. So for a 2-minute process focusing on gratitude, that affects your immunity for 8 hours. Yeah.
So that's what the Heart Maths Institute research has shown. So I say to people, if you just close your eyes for 2 minutes and just say thank you to your heart, which is an easy way, because some people go, well, I don't know how to feel gratitude. What is it?
Do you mind if we do that? Do you mind if we take 2 minutes and close our eyes? You can lead us through 2 minutes and let us know when 2 minutes is up.
Yep. Okay. So, no worries. So all you need to do is basically just close your eyes for a moment. And some people like to put their hand on their chest. Some people just imagine where their heart is. And all you need to do is just to go inside for a moment. And as soon as you close your eyes and you begin to go inside, you just begin to give yourself that opportunity to appreciate yourself just by going inside for a few minutes. I sometimes say to people, it just reminds you of how important every cell in your body really is to you. And if you just go inside and you just imagine your heart for a couple of moments, and you just imagine thanking that heart for beating for you thousands and thousands of times in your lifetime, not asking for anything in return, it's just simply doing what it does. And not only is it beating away in your chest, but it's also sensing and giving you energy, and it's giving you warnings about things that are around you. But so many people just forget about it. So many people think of it as just a machine, just a mechanical pump, but we know that it's so much more than that. So if you just think about your heart just for a moment, and you just say, thank you Thank you for doing what you do for me. And you just sit there for a moment in silence and think about that heart. And then I didn't exactly time it, but that's close enough to 2 minutes. And then you can just feel that shift, because it doesn't have to be specific anyway. But you just, when you do that, you're just getting that heart and mind to just get into that same, get into sync, get into balance. And that just makes those changes deep inside. So if you could just do that, everyone's got 2 minutes in the morning and 2 minutes at night. Because I think I teach, and I've talked to a lot of people about meditation, and some people say I don't have time to meditate, it's too hard. You know, there's thoughts go through my head, but even if you can just sit there for 2 minutes and think, thank you, thank you, thank you to my heart, it's going to make such a change over time.
Yeah, and I think, you know, there's so much written and there's so much experience around the power of gratitude, and it's always fascinating to me. You know, we can be grateful for so many things. We just have to be creative about looking for those things. You wouldn't always think to be grateful for your heart, and yet, you know, we're not on the planet without our hearts.
That's right. Yeah.
So it's a thing. I just wanted to share with you a couple of people making comments in the Facebook group. So I wanted to share a few of those. And also just to remind you, if you are on the Zoom link or the Facebook group and you'd like to ask Craig any questions, please feel free just to drop them in as we're going along. We've still got a little while to go, so we're all good for time. So someone's saying, so true about thanking your heart. So agreeing with you. Someone's saying, love you, Craig, Denny. So you're famous and people are liking you.
Thank you.
And someone else is saying you do great work, Craig. So
that's great.
See if there's any others. Yeah, they're the main comments. So people are enjoying it. I have another question for you. My question is, what about in a situation? So I'll give you a specific situation. A friend a while ago now, maybe 6 months ago, was in a situation where she was in a club late at night and she had a glass thrown at her and it severed part of her, one of her nerves. And she's had a number of surgical procedures as a result of that. And the long and short of it is that it's been very hard to fix. And, you know, even the best surgeons have found it a difficult thing to fix. So she is now in a lot of pain and it causes her leg to collapse regularly. So in something like that, where there is a pretty clear physical origin of the pain, can hypnosis still help to support the management of that pain?
Yeah, you can. You can ask the subconscious mind to turn that pain down or to change it slightly. And it's often quite effective like that. You know, of course, back in the day, before anesthetics were invented, we used to use hypnosis for pain relief before you would have surgery. So they used to put someone in hypnosis and they'd remove a limb or tumors or many things, and the people would get through that. So yeah, and also people used to do tricks, you know, where they would put someone in hypnosis and put a needle in their arm and they wouldn't feel the needle. So and for that girl's, you know, that event obviously is fairly traumatic anyway. So her subconscious mind was probably quite upset about that without talking to her. There's probably a lot of other stuff going on, and maybe it's trying to protect her now. Maybe it's thinking that's going to happen again. It could happen tomorrow, tonight, anytime, because, you know, as we talk about, the mind is just taking our senses, our sight and sound and taste, etc., and trying to make a picture of what's happening in an outside world. And as a lot of people say, it doesn't really know if something's happening or not. And if she's visualizing that on some level, even if she's not really consciously aware of it, if she's picturing that happening again, it thinks, my God, it's happening again. How unlucky am I? and it's reacting to that. So it can cause that, and maybe it can cause that pain. Sometimes I've found to protect her, to make her keep that arm away or whatever happens so it doesn't get hurt again. I've worked with a young boy with chronic regional pain syndrome, which is a like a neurological sort of thing as well. I've worked with nerve pain before and made some changes when people have been told that there's nothing you can do now. And I'm not saying it works for everyone, because it doesn't. Nothing works for everyone, as you know. You can go and have surgery and you sign a waiver to say there's a chance it may go wrong and may not work. So it doesn't suit everybody. It just suits a large percentage of people. So so for her, but yeah, I mean, there would have to be, obviously that would be a horrible thing to happen. So there'd have to be some trauma around that. Yeah,
definitely. Yeah. Okay, a couple more questions. So someone is asking, this person says, you mentioned new mums. Have you ever worked with mums with postnatal depression?
Yeah, I have. And, you know, as I said, because they go through so much stuff, especially if there's someone in their ear telling them that they should be doing this and they should be doing that, which, as you know, quite often happens with new mums. There's always some relative or friend with lots of advice. And generally, you know, mums know what to do anyway, but they just get confused. They confuse themselves. So yeah, I've made some changes with some young mums with depression. Again, it doesn't really matter where it came from. We can make some changes with that, building the self-esteem, letting some stuff go from the past. So yes, be curious if she had any pain as well. They often do.
Sorry, and this person is just asking a second question, and the second question is also, what about ghost pain for an amputee?
Yes, I haven't worked with that. I've got a friend. I've been in talks with someone in an organisation to try and do more of that, because yeah, there has been a lot of in some of the groups that I chat to with some other hypnotherapists I know overseas that have been working a lot more with that. They said there's been some amazing results, because again, the subconscious mind doesn't even know if that limb or whatever is still there, and it can cause itchiness or pain or something in that limb. So we need to make, and of course, there's enormous emotional trauma when it comes to amputees, whether it's due to a medical reason or a traumatic event. It's the same sort of trauma anyway, emotional trauma. So yeah, it can make some huge changes with that.
So is it fair to say that almost regardless of what the injury is or the detail is of how someone's presenting, if there's trauma around it because of that build-up of unprocessed emotion, that's what you're going to be focusing on?
Yeah, and sometimes, and like I said, sometimes the subconscious mind can hold on to some emotional trauma for decades, until something can happen and it goes, that's what I've been waiting for. I'm going to use that and run with it. You know, I worked with, as I said, that lady in the bus, on that bus trip. It had held on to that emotional stuff for around 60 years. She'd probably been pretty safe and never really hurt herself. So it's gone, the bus trip will do, I'll take that and I'll run with it. And so she had pain ever since that bus trip. And so I work with other people that have been in significant accidents and stuff, and the trauma of the accident wasn't really the cause of that long-term pain. So even though they had an injury, it's still, I believe, it takes it and runs with it and says, good enough, I've been looking for something.
Yeah. Okay, someone else is saying, how would they, so say if someone in your life has had surgery and they've come home from surgery, what could you do to help support that person to feel less pain?
What could that I do, or the person with them?
I think they're asking what they could do, but maybe answer both those questions. What they could do and what you could do.
See, I worked with a lady not long ago who had back surgery, and she'd had a lot of pain post the back surgery. And then she went to another specialist, and he said, I can't believe that surgeon did that procedure. We haven't used that for years. He shouldn't have done that. So she had so much resentment towards the surgeon then that pain was getting worse and worse. And we had to work on that and let that go. So I'm saying if there's anything happened that's gone wrong in the hospital at some point, there can be emotions attached to that, or emotions around something that happened just prior to the hospital. As I said, it could be something much earlier on. So I think that, you know, if I was the person at home or if I was the relative at home, I would help them start to do some meditations, because meditation is brilliant for stuff like that. I've got a heap of meditations on my YouTube channel that are just sitting there for free for people to use for all sorts of emotional releases. And I have one for pain. I have one for healthy eating, stuff like that. So, you know, I think that would be a good step. You can sit there once you practice. It takes time, you know, to learn to meditate. It's easier for some people than others. I've done it for about 3 or 4 years straight now without missing any days. But that because I'm just committed and I love doing it. But I think so that person, if they could just try to learn to meditate and imagine that part, whatever's going on there, getting better, then sure enough, as you know, the body can start to heal itself and make some wonderful changes. They can visualize that part improving or that pain decreasing, whatever's going on there.
What do you think? You're talking a lot about the role of the subconscious mind in pain. Can you talk a little bit about the role of our senses in pain, our different senses?
Yeah, what do you mean?
You know, I'm just thinking, if we're smelling, touching, feeling, etc., the way, because that's the way we process information. So that would be the way that we would send messages to our subconscious mind that we're in pain, is through our senses. So I'm interested, in terms of hypnosis, are you intervening like at that sensory point in time, or are you intervening more, it's already in your subconscious mind and that's where you're dealing with it?
Yeah, dealing with that at that deeper level. I mean, some people can, you know, connect a sound or a taste or a smell to a certain event that can cause them to go back to that event and feel that feeling, so we can change it and make a disconnect from that event. Like I said, the lady with back pain who got pain every time she sat in a car, or if someone's had a horrible time at work and suddenly they may get sciatica or back pain every time they sit in an office chair because they've conditioned themselves. And of course, you know, they may have been rewarded at some point by getting some time off work. And so the subconscious mind on some level said, yes, I've enabled them to get out of that bad situation at work by just simply giving them some back pain. So I'll just keep doing that. And so they can basically think about an office chair and get pain in their back because they're getting that good at it, that good at making that connection, and that process is just so fast.
Yeah.
So
you know that concept in NLP that's called secondary gain. Are you aware of that?
Yeah. And I have clients with that. I've worked with a young lady with fibromyalgia, and unfortunately there was too much to gain by having it, too much to lose by losing it.
Do you want to describe secondary gain to people so that they understand what we're talking about?
Well, to make it simple for her, mum, dad and boyfriend would run around and do everything for her, and she wasn't lazy, but she just liked being cared for and looked after. Possibly she didn't have enough of that when she was younger, and now that she had fibro, she was suddenly getting a lot more support and a lot more care, and she was worried that if she stopped having the fibro pain and could just go back to work, everyone would forget about her again, and she'd lose all that support that she currently had. So that's an example of secondary gain. So it's the gain that you get from having the condition or whatever's going on, and so for some reason you're hanging on.
Yeah, so and it helps you to reinforce it, so you're hanging on to it rather than moving past it.
Yeah.
And it's also usually the thing you're most resistant about. If someone asks you, what are you actually gaining from this situation, and they give you this blank look and they're like, what could I be gaining from laying on my back for 2 weeks?
Yeah,
as an example. And yet when you do start that process of inquiry, it is quite interesting what people come up with. Yeah,
and they'll get angry, not sometimes initially, because they're defending it, saying that you're calling them lazy or something when you're not. You just trying to find out their reasons for holding on to it.
That's right. And it's a good way of, you know, interrupting their pattern of thinking as well. A couple more comments. So someone's just saying, and this, they're very grateful for the conversation that you're sharing today. And they're saying, I really needed this. Thank you so much. So that's obviously, you know, right on point for that person. Another question. So someone is asked, and the person asking this question, interestingly, is a doctor. So just to give you a bit of context. So she's saying, do you work with people before major surgery or chemotherapy to improve their experience and outcomes?
Well, yeah, there's a couple of sides to that. So I've worked with people, of course, with phobias too, as far as needle phobias, medical phobias. You know, some people are obviously very anxious. And of course, if they're
treatment,
and if they've been given a negative diagnosis, if they're quite unwell, then of course there's going to be a lot of anxiety and stuff related to that. It's been proven that hypnosis and relaxation techniques speed up recovery in most patients as well. But yeah, so I've worked with people to make them better prepared for whatever procedure or whatever's going on, so they can go in there and have that belief in the ability of themselves and medical staff to help them. Because some people, of course, too have preconceived ideas, like the lady post back surgery who suddenly would not want to have any more surgery because she'd lost faith in the medical system. But now she sort of let that stuff go so she could go back and see someone else again if she needed to. So pre-surgery, just to help them feel better about going ahead with it. Is that all? Is there something more? Sorry?
So the person who wrote that question, just let us know if that's been dealt with adequately or if you would like to see any more from that. But someone else is just commenting saying pre-surgery management, wow, that's powerful and useful. And when you think about it, if you, like what you said before, you just kind of said in passing, but I really should have paid more attention to it. Can you tell us more about the cultures or the ways in which hypnosis has been used as an anesthetic in the actual surgical process as opposed to post or pre-surgery?
Yeah, and it's still used in some places. I don't do it here, so I'm not right up on it in Australia. I know it's some parts of the US and Europe. It's used especially with dental work. If the person cannot have anesthetic, they're allergic to a lot of drugs, then they can have, there's special, I know a lady that's in Dubai, for example, and she's a specialist as far as dental hypnosis is concerned. So she specializes in that. So a lot of dentists in that region will use her to basically numb the area. So there's an old thing where you can just numb part of the body. Well, the mind's doing it. You're just guiding it to do so with the hypnosis. It's called a glove anesthesia, where you can just numb basically the arm, for example, or I've worked with people here and you send a cold sensation like ice through their body and their hand just gets colder and colder. Sometimes it's just to demonstrate the ability to give them that belief and understanding how powerful their mind truly is, because sometimes they've lost faith in that ability to heal. And you can say to them, look, you've done that, you've made your hand basically turn to ice or it won't move anymore. So if you can do that, you can make these changes that you're trying to make easily. And going back to that, doctor mentioned cancer treatment too. Hypnosis has often been used just to reduce some of the pain and some of the nausea that's related to some of those treatments as well.
Particularly.
Yeah. Again, I haven't worked in that field, but I know there's a lot that do.
Isn't that fascinating? I always think, when the whole philosophy of medicine, in theory, should be, do no harm. It's amazing to me that things like hypnosis and other methods where you can't lose, like, how can you possibly lose? Why would you not try that before you would then try some other kind of anesthetic that might have some other, negative interaction with something?
Yeah,
It's
that's
just
what
amazing to me that we're so reliant upon methods of care that are invasive and can be more dangerous before using, the kind of things we're talking about. It's quite incredible, really.
And hypnosis has been around, I think, since the ancient Egyptians, since the pyramids. It's just went out of vogue for a while, but a lot of people believe it's starting to make a comeback because people are realizing that it's so simple and it's so powerful. And like you said, I often say that to people, the absolute worst case scenario, the worst thing that can happen is nothing can happen. You won't get the outcome you're after, but you'll have a nice, relaxing time for a little while. That's worst case scenario.
I also want to go back to something else you mentioned. You were talking about in regards to the person being able to help when someone comes home from surgery, and you were talking about meditation and the role of meditation. So I hadn't really quite put this together before, but is meditation basically, in essence, at its basic form, a form of self-hypnosis?
Yeah, it's very similar. And hypnosis, like I said at the beginning, we're going in with a specific goal and specific outcome. Generally, meditation, you're just trying to relax. Often people aren't trying to, achieve a specific. Sometimes people are, and you can make your own self-hypnosis soundtrack. So you can record something. You can record your own voice. Learn to relax your body. Like I said, my one's on YouTube. They're pretty easy. It's just about relaxing your whole body, going through each muscle, like a progressive muscle relaxation where you're tightening and then releasing each muscle in your body. And you can always record your own voice saying, I'm going to heal, I'm going to feel better, I'm going to heal, I'm going to feel better. Putting lots of stuff into your own meditation like that can make a significant change. So yeah, they're very close in the state that you're in, but generally when you do hypnosis, like here with me, I'm talking you through a whole process, and we're going in, we want to let go of this and let go of that and then put this good stuff in. So we work it out beforehand, and we sit down and exactly what we're wanting to achieve from that session. Whereas generally meditation is just seeing what happens, really.
It's less outcome focused. It's more.
Yeah.
So
it's brilliant too, but yeah.
You've mentioned a couple of times your YouTube channel. How do people find you on YouTube?
They can look at, they can YouTube. I can put a link if you like at the bottom of this.
Yeah, that'd be awesome if you could. Yeah.
Yeah, that might be easier.
Is it just under your name or?
Yeah, Craig Denny, Charlestown Hypnotherapy. It's got both on it. But I can just send you the link or put the link below if you like in a comment.
Yeah, that'd be fantastic. And the person who was the doctor with the question about the chemo said, thanks, I'm interested in a proactive, positive approach to achieve superior outcomes for all treatments. So I think it's safe to say to be using some kind of hypnotherapy within that mix of what you give to patients, you would be doing exactly that.
If that doctor wanted to message me, I could send. There is a hypnotherapist in the UK that specialises in chemotherapy, and he's done many research papers and stuff on that.
Well, would you be able to put that link in as well? So if you can put in your YouTube link and also put the link to that doctor in the UK, then that would be awesome. That would be really helpful for people. Another question I have is, if you kind of taking a step back and really looking at the big picture of all of this, if you had to give a percentage of pain that happens because of emotions versus a percentage of pain that happens because of some kind of physical thing that's unchangeable, what would you say about that? Would you say that you hoped I wouldn't ask that question?
No, I'd say I went back through all my clients a while ago to look at my stats on pain alone, and it was around 75 to 80% of the clients I worked with had significant pain reduction, if not completely gone. So yeah,
that's powerful, isn't it?
So it's pretty good compared to others.
Yeah, that's great. So do you specialize in pain? Is that your core specialty?
Pain and anxiety. I really specialize more so in anxiety, but as I said, they're very much interwoven, and the treatment, it's almost the same anyway, from my perspective.
Okay, so from someone who doesn't understand how they're connected, how are anxiety and pain connected?
But because, as I've said all along, I believe that pain is basically just trapped emotions, some sort of emotional event or some stress or some anxiety. Like I said, that lady that was very stressed in the workplace, going into work each day and expecting to have back pain because she had all that anxiety about work and all the colleagues that she was working with. She was getting bullied and harassed in the workplace. So that anxiety and stress, that subconscious mind desperately wanted to somehow protect her, and it thought the quickest and fastest way would be to cause pain so she could get out of work. So that was the anxiety that just directly led to sciatica. She had sciatica.
Because I think that's the interesting thing, that it doesn't, even though one causes the other, they're not always directly connected. Like it could be some strange emotion that you've had from when you were 2 that comes out later in your life in some other kind of pain in your ear, as an example, and they don't in any way seem connected at all, and yet they are.
Yeah, that's right. Yeah, you know, I had a lady that had all this pain in her neck all the time, and it was because she felt she was never heard when she was young and she couldn't speak up and, you know, defend herself when she was a little girl, and that was causing all this throat and neck sort of pain, which was what you mentioned actually about a specific region relating to a specific thing. In her case, you know, that was, she had all this tension and stuff all around that region because she just felt she was never heard. That just came up as
the throat chakra stuff, isn't it? In
terms of
heard. Yeah.
And so when I talked about not being heard, she started to cry and realised
that really hit home. Yeah. So someone else is asking, do you work with children, and is this approach beneficial for 14-year-old child particularly?
Yeah, I've worked with some teenagers, depending on what's going on. I worked with 2. They were both sport related. So I worked with a young girl that did gymnastics, and she was really good at gymnastics, and she had been doing it, you know, for, I don't know, 10 years or something. And she just made it into state level. And as soon as she got into state level, she couldn't do gymnastics anymore. She went massively backwards, couldn't do a flip, was scared to walk on the beam. All this stuff came up. And we did some work with her, and we found out that, well, I just found out when I worked with her that that extra bit of pressure somehow took her back to when mum and dad split up, and she was just reacting to all of that. That subconscious mind just somehow associated the pressure of this much higher level of sport that was similar to the pressure she'd felt back at home. So that's like one example. And another boy was the same sort of thing. You know, and obviously bullying at school is an obvious big one.
Have you ever dealt with any kind of mental health related things in teenagers?
Well, I don't really deal with a lot of, depends if someone's been diagnosed with mental health disorders, and if they have, then I would prefer to get a referral from their GP to work with them.
Yeah.
You don't have to do that, but I'd like to work alongside the GP, depending on the diagnosis, because you just want to make sure, I just want to make sure I'm doing the right thing, and I want to make sure that the doctor's happy.
Everyone's aligned. Yeah.
So that would be more an individual basis. So I have to look at that.
Okay, cool.
If they're just stressed or bullied or something like that, though, and they've got a mental health.
Yeah, so if it's more anxiety and things like that. Slightly lower level. Yeah.
But I don't specifically treat schizophrenia or bipolar or any of those sort of disorders, because that's not what my specialty is, and I don't do that.
Yeah. Okay. And apart from through your YouTube channel, a couple of people are saying, how can they contact you? So what's the best way that they can contact you?
They can just Google Charlestown Hypnotherapy.
Charlestown Hypnotherapy. Okay.
Yeah, that's the easiest.
And I'm assuming you do long distance stuff if someone's in Melbourne?
Correct. Yeah, I've worked via Zoom a lot recently. As I said to you before we started today, I've only just recently started going back to face-to-face But yeah, so, and it's quite effective. Some people would prefer that. I worked with a lady recently who was in Port Macquarie on the North Coast, and she felt more comfortable doing it via Zoom, because some people just prefer to sit on their lounge in their own home. Just got to make sure you just have an iPad, laptop, whatever, with a camera, so we can just talk to each other like we're doing right now. And yeah, it's really effective, just as effective.
And the answer to this question might be similar to one that you gave earlier, but if you're at home and you have pain somehow, somewhere in your body, and you don't have your friendly hypnotherapist on hand, and maybe you've never meditated before, is there anything else that you can do to try to, like right in that moment, to try to reduce that pain level a little bit?
Well, you can, yeah, you can do what we did before, and you can focus on your heart for a start, and just close your eyes for a moment and try to relax, which slows down your breathing, it slows down your heart rate, and then the body just begins to settle, because as we know, the body and the mind just want to get a balance. It wants to reset and get back to that homeostatic state. So I think simply just closing your eyes for a few minutes and going inside. Of course, some people struggle with that because they have so many thoughts, so many overthinkers, especially a lot of professionals. You know, I've worked with a doctor, I've worked with some accountants, and they're often so much in their head that they struggle to relax and let go, which with hypnosis, that's fine. If I'm here with them or via Zoom or whatever, you can take a little bit more time and get them into that deeper relaxed state. Sometimes it just takes a little bit more time, and then we can teach them techniques, or I do a hypnosis session on reducing that overthinking so that they can begin to clear that mind when they need to, especially if they do it in bed at night. So yeah.
I bet those of us in the world who are overthinkers experience more pain.
Yeah, probably, because, and you get a lot of people, I work with a lot of people who catastrophize about their health. So, you know, they get a pain and they go, oh my God, I'm having a heart attack. Or, you know, they can just do that. They can just unwittingly start doing that process. I worked with a lady who had her sister, who was quite young. She died from diabetes, had a hypoglycemic episode and passed away. And after that happened, this particular lady started really catastrophizing about her health, and she started panicking about her children, and her children would go near a step and she'd say, stop, you might fall and hurt yourself, or, you know, and unfortunately it was taking over her life. She was suddenly becoming so overprotective of her children, saying, stop, you might die, saying things like that. We had to get onto that before she started programming those children into being, you know, so anxious and worried. And it's just like,
I think it's fair to say that, and, you know, you let me know if you agree or disagree, but I feel like as humans, we have this collective responsibility to deal with our own pain because of the effect that has on the collective, aside from the effect that it has on us as individuals, or as you're saying, your grandparents or your however many line, you know, whatever your lineage is through your family. I feel like we have a responsibility to deal with that, all of us, every single one of us.
Yeah, that's right. And before you start passing it on to your children, like we said, or affecting those around you, because of that, as I talked earlier about the heart coherence, that energy, that feelings that you're feeling that just are buzzing all around you and taking everyone else to that level. And they've done many studies on, you know, they get thousands of people meditating at a certain point and crime rates drop in that suburb. Or
I love those experiments.
Yeah.
They're fantastic. All right, we're almost coming up to time. So what are your last words of wisdom that you would like to share in regards to pain and emotions?
That, well, for a start, if anyone feels a bit, often people will feel agitated or think that sounds like a load of rubbish, and that could be a signal that it's true for you. If it's bringing up any feelings of irritability or negativity, that can be a little, the old subconscious mind just poking you, saying he's hit the mark and maybe you need to do something about it. So yeah, like I said, with hypnotherapy, it's often worth a shot, because, as I said, the worst thing that can happen is you won't get the outcome you're after, but you will get some changes. You may start to feel a little bit better about your life, about yourself, which is mostly what I try to do with people, to make them begin to love themselves and believe in themselves more. That's half the time. You've fixed half the problem just by doing that, getting some self-belief and some self-love happening.
Absolutely. Bring on the self-love in truckloads, I say. Thank you so much. I've learned a lot, and I'm very sure that based on people's comments, they have found this so useful, and there'll be some good take-homes, where people can really go home and try the connection thing that you talked about with the heart, and try a couple of the other things. So thank you very much. People are saying another great presentation, and Craig, I love your holistic approach, etc. So you can look at all your fans on the Facebook feed later on.
Thank you.
And again, for those of you that wish to contact Craig, please find him at Charlestown Hypnotherapy. And someone has already put the link into your YouTube site, but if you can drop in the other link, that would be great, Craig.
All right. Thank you then.
So thanks again. Appreciate your time.
No, it's a pleasure.
Okay, take care.
Okay, thanks. Bye.
Thanks again, everyone on the Superhuman Summit, for listening, and we will catch you for our next episode. Take care. Good evening.